Listen.
I've been hearing a lot lately about men don't talk, but in my experience, men do talk, just people aren't listening. So it's going to be me and a group of blokes discussing our struggles and victories through life. Warning, there may be some bad language, so apologies to all the mums, especially my own. Let's get going.
Listen.
I've been at the Black Country Blokes, chewing the fat about everything that is mental health, disability, and life in general. Here with me, Kev Dillon, and my partner in crime, as always, Lee Cadman. And today we're joined by Dr. Steve Mann, who's a GP. He's been a GP for about 30 years, Doc.
31 years, I'm afraid.
Yeah. So this episode, we're going to be talking about everything that is men's health, men's mental health, health in general, Movember, and anything else that you guys want us to talk about. So please be a part of the conversation. But we're going to start the show, as we always do, with our gratitude list. And we've been pulling my hair out because my boxer, Osman Mohammed, who's boxed for England in the world, he's just been on. He's just won on a unanimous decision. So I'm over the moon. But I was so grateful. It was in between the lesson. Doc, get in here. And it was brilliant what he did. We just watched it together. Perfect timing.
When I come in, I think we were going to get that, did I? I thought he's going to land at the wrong time. But yeah, perfect timing.
Boxed really well, you know. He stuck to his boxing against a lad from Latvia who come in, but stuck to his boxing, and then that first one's out the way. Because if anyone's ever boxed, especially in boxing tournaments, it's that first one. You don't want to go out on the first one, which is no shame in. Someone's got to do it, but you don't want to lose on that first day, do you? Because you know you want to progress, and whether you come home with a medal, don't come home with a medal, but get that first one under the way, and it'll get better and better now. What are you grateful for, bro?
Dudley talking therapies.
Oh yeah.
Yeah. I mentioned on the show a few weeks ago now that I'd self-assessed myself to do it. That's not the right word. Self-referred myself. They got back to me this week, and I've got an appointment next week. She's fantastic, and I think it's great that you can just go online now. You know, we don't have to bother you doctors to do it. We can just go online, self-refer, and someone will phone you. You go through a few questions, and I suppose they assess the urgency of the situation, and point you in the right direction. Or actually, she gave me 3 options at the time, and I think one was what I've chosen, which is therapy, face-to-face. There was another option of doing online, and there was one more, I can't think of it now. But anyway, they got in touch last week, and my appointment, it would have been actually Monday, but I couldn't make Monday. So it's the end of next week, which is fantastic. We can do that.
Yeah, Dudley Talking Therapy is great. And it's run by Dudley Integrated Health and Care. I don't know if you went through that route to get to them.
Yes.
But if you go to put DIHC into Google, you'll find Dudley Talking Therapies. And you're right, you can refer through to, they usually get back to you within days. And then
I think my initial call, the initial assessment call was within a day.
Yeah.
And then obviously you're just waiting. They give me 3 options, and then you wait for the one that you've chose, I suppose. And I think mine took slightly longer because I wanted face to face.
Yeah, I mean, it's interesting. So I think us blokes do want face to face, because I know they will offer groups, and I often find that some groups work well for some people, but I think blokes, we tend to be we're more sensitive than people think we are. I think.
Yeah.
So we prefer to work individually, and the online Silver Cloud is the online CBT.
That was it. Yeah.
A lot of patients find that really good because they can then fit that around what else they're doing.
See, I've thought of it the other way because I'm quite a busy person with running my own business, looking after my daughter, doing podcasts and radio, and I thought that would just stress me out more. That I think I've got to go and kind of complete this course, complete this thing. Whereas having one meeting and turning up for that seemed easier. But it's each their own, isn't it?
I think it's about knowing yourself, isn't it? What your preferences are. I mean, I think some things aren't negotiable. So if you think of Alcoholics Anonymous, their whole theory is around a group and a team supporting you. That's great, but it doesn't fit for everybody for every mental illness. And that's why I think having that selection from, in Dudley is great.
Yeah.
As far as I'm aware, I don't know whereabouts else in the country it's like that, but being able to refer yourself, I mean, quite often patients will phone the surgery and we'll phone them back, or even send them a text saying, have you tried this? And
well, I went through the route of Dr. End of 2018, 19. And the only reason it went that way is because I went to doctors about something else. I can't even remember now. And it was at the time where my daughter had been seriously ill, or just after. So I kind of thought I'd handled that and got over it, but actually I'd just buried it to look after my daughter. And I went into a doctor for something I can't even remember, and broke down in the doctors, and he referred me. I didn't feel at that point this time to go and bother a doctor, to be quite honest. But Kev actually pointed out that I was struggling and said you needed to sort yourself out, sort something out, some help out, not sort yourself out. So yeah, and I did find it. I think for me as well, I wouldn't have phoned the doctor. Whereas getting online and not having to contact someone, or see someone face to face, I found easier. I
think you're absolutely right, and I think a lot of healthcare. You know, I think if you talk to people, they often think of a hospital, they think of their GP, and actually, I think the way healthcare is going, with all the stresses on the NHS, restrictions in staff funding, and all the rest, actually helping patients self-manage is really important, because there are lots of things we can do for ourselves which are, you know, as good. And actually, that's brilliant. That's a great example of, you know, you've managed yourself, and actually the benefits to you of getting the help you need without having to wait to see a doctor or speak to a nurse or come to the surgery is brilliant. And I think that's the way we should be going as a country, really, and encourage people not just about mental health but physical health as well, looking at how you manage your own health, so then, you know, you don't need to access the NHS, because as it is, it's kind of got more than enough work to do already.
What are you grateful for this week, Doc?
Sorry?
What are you grateful for this week?
We've kind of gone off on
what am I grateful for this week?
We always do.
What am I grateful for this week? Let me think. Well, on a personal note, I'm grateful. I'm happy and well, and my COVID test was negative. It means I go to work.
Yeah,
that's one thing. On a wider level, that's a really, really good question. I think it's a good way to reflect about, you know, where you are and what you're doing. Grateful for this week. I'll tell you what I'm grateful for. I thought the weather's great. Weekend, lovely weather. It could have been late September, and I think the weather was a lovely thing to have. And actually, it didn't feel like November. Didn't feel like it's nearly Christmas. So
no, saying
weather was
exactly the same to my wife. It just, yeah, you don't expect that kind of weather in November. No. It's fantastic. You can get out and not be shivering or wet, or, I mean, you come down a bit today, but you can't have it all the time. We need a bit of rain.
Yeah. Isn't it funny, like, when you think grateful, what am I grateful for? You go, my health, and nice weather. Let's quite frankly, they're two major things, aren't they?
Absolutely.
For someone who's always poorly, myself, and you're thinking, you know. When we're poorly, you go, oh, I've never felt this bad. Oh, I think I'm dying. And we acknowledge it when we're poorly. And sometimes we don't go, you know what, I feel bloody brilliant today.
Mm-hmm.
I'm going to go and do, I feel that well. I'm going to do something.
Yeah.
We go, oh, well, I feel great, but I'm just going to sit here on the telly. I'm going to swallow my phone. And it's being self-aware, isn't it?
Yeah.
Thinking, you know what, I am feeling all right today. Sometimes I'm not even feeling 100%, but I'm well enough to get up and do something, be an adventure with your family, contacting a friend, whatever it is. Make the time when you're okay to do something positive.
Yeah. No, actually, you reminded me. Went for a lovely walk on Sunday afternoon back over the top end of Norton, towards Hagley. It's just nice, you know. We said, "Oh, great, let's just go out for a walk," because, you know, you're right. Actually, take that time just to think, just to do the simple things.
Well, in the lockdown, me, my wife, and my daughter, because we couldn't do much, you go on your walks, and you go to Kimber Edge, you go to Himley. There's a field by my house in Kings Winford, and we're over the railroad tracks. And Jasmine, my daughter, hated it. She was there, and then by the end, we're enjoying it because we're seeing nature waking up, or we're seeing nature falling asleep, or we see a birdie or a squirrel. And then once the doors open and we're back in the rat race, you don't do it anymore.
No,
it has to be expensive days out, or it has to be grand days out, or it just. And you're thinking, it doesn't matter if it's a bit wet or a bit cloudy or a bit muddy. Let's just get out, have a bit of fresh air, a bit of exercise, and wow, I've been here all my life, and I've never noticed that tree, or the flowers are in bloom, or oh look, there's a squirrel.
Yeah,
and that's nature at the purest, and we're so lucky where we live, aren't we, around here?
Yeah,
that we've got Greenbelt over there, we've got the woods over there, we've got the canal over there, and we've got it all in front of us, but we don't do it.
No, I think that's a great point. I mean, I love it in these sort of early evening, probably in the summer it's a bit warmer, where all the birds, you can hear them just quietening down. The world's just going to sleep, and it's just a relaxing, nice time, and it's warm and the sun's going down. I think you're absolutely right. And you're right. I mean, people away from the Black Country don't know where Stourbridge is. So if I'm down south somewhere, I say, well, if you get to Birmingham, turn left. When you see Greenbelt, that's where we are, but that's the edge of the Black Country. And people sort of get it.
Because you think of us, obviously, the Industrial Revolution and the factories, and there are loads of factories around here, aren't there? We're very built up, but everywhere around it is a cut, a canal. There is a bit of, like, you know, you'd have to, the iron mason be cooling it down or loading it up on the canal, and the canal's cutting through, and then you've got the woods, and we've got the best of both worlds, I think, around here. You know, and we're so lucky to have it because we're not a concrete jungle.
No.
So once we could only have an hour's exercise every day, it was, come on, Bab, let's go for a walk. And in that hour, without driving, we could nip somewhere, you know, have a bit of fresh air. So, you know, I'm grateful for that. But I mean, I'm grateful for you being, we're grateful for all the NHS. I mean, it seems like forever since the madness of COVID. And we were all there going on our Thursday nights, clapping and smacking tins, and we love you, NHS, and we were all doing the rainbows and thank you. And all of a sudden, the nurses, the doctors, the cleaners are having to pay for their parking again. They can't do this. The nurses want to be going strike because how terribly they've been treated. These brave bookers were going off with no PPE, like yourself, like the cleaners, like you know, all these people around the NHS who were that brave when it was the Black Death. You know, when it was, we were watching on TV, people falling over and dying, and we're going, we will do it. We will turn up. You know, we will do our jobs. And the mate, and then all of a sudden, well, unless you've had your injections, you're going to get fired. You go, well, hang on, we've battled in the trenches when we thought it was the death, and we were willing to die. We were willing to not see our families, and now you're treating us so appallingly. And I find it so bad that so many brave people were treated so badly after the fact, during the fact, but especially after the fact. How was it for you when you were there being?
I was lucky I didn't get ill. I think I had COVID early on, and I suppose I'm just lucky I didn't get very unwell with it. So from that point of view, once I'd had COVID once, and once I had my first vaccination, I was kind of a bit more laid back about it. I think you have to take your hats. I mean, you know, we were kind of in an easier place. I think, you know, the staff in hospitals, you know, in ITUs, I mean, that it just looked harrowing, you know, and I think there's that side of it. I mean, the people really in the firing line in the hospitals, you know, particularly your intensive care, you know, staff, whether they're doctors, nurses, cleaners, providing the food, doing whatever, that must have been grim. I think you're absolutely right. And then, like I said, I think the vaccine came along. You start to look, things got more positive from there. I'm sad that people feel battered by the NHS. You know, I'm sad that people feel they need to go on strike. Really, I think we've got a unique set of circumstances with cost of living, you know, inflation, and the workload in the NHS. And I think, well, let's be fair, they haven't gone on strike yet, have they?
No.
And I do hope it's a negotiating position that can be worked back from, because at the end of the day, as a country, you know, we're the 5th biggest economy in the world. We shouldn't have 7 million people on waiting lists, and we shouldn't have medical staff going on strike. And it's a privilege working for the NHS, quite frankly. And I hope we, you know, let's hope that doesn't happen. Would be my personal view. I personally, you know, wouldn't want to go on strike because, like I said, the NHS is bigger than any of us, really. I think the frustration is, I mean, personal view is, I think there's enough money in the NHS. I just don't think we're quite spending it wisely enough.
I think that's the common feeling of it. Yeah. We can keep throwing coal into the fire, but you know, let's just manage it a bit better. You know what I mean? Because, well, the rich will always get rich, the poor will. You know what I mean? But then there's that massive divide. Yeah. But I think the people who get in, anyone who works in the NHS, be it the volunteers who are passing the coffees around, are good, caring people. Yeah. But I feel like with all organisations, is we've got to treat them better, less agencies, and giving people stability. So if we do get sick, let's look after the people better. A happy worker is a better worker.
I think you're spot on. I think this may not be about money. I think, you know, at the end of the day, in my experience, you know, of employing staff over 30 odd years, on the whole, most people don't leave for money. They leave because they're unhappy about other stuff. Yeah. And maybe it is about that value people feel they get from their job, the satisfaction they get from their job, the appreciation they get, the teamwork. I mean, I think, you know, teamwork is really important. And I think, you know, at DIHC, you know, I do 2 to 3 days of my practice and 2 days of integrated health and care. very high on our agenda is, we want to be seen as the employer of choice. I think probably, with all the things, I think the politics behind the NHS and the finances maybe drive some of the behaviours that mean people are unhappy. And maybe it's, because you can't buy everything with, you can't buy people with money. But what you can do is motivate them by doing the right things. And that's what we're trying to do here in Dudley. And that's, that's what you try and do in any organisation. I suspect that's been lost a bit through the pandemic.
In your 31 years, I bet you've seen dramatic changes, haven't you, in how we treat patients, how it's just changed. Who would have thought in anyone's lifetime would have had the pandemic? Yeah. But in general, from when was it, the 90s to the 2020s now, what major changes have changed? And why did you become a doctor?
I don't know why I became a doctor. Well, I became a doctor because I thought I wanted to do it. It wasn't like I had a burning desire or, road to Damascus. That's what I wanted to do. I just enjoyed those subjects at school. I liked the idea of being a doctor. My contact with medicine has been very limited. I haven't got any doctors in the family. So I was the first person to do it. And I just think, we had some friends who were doctors. And I think I just saw the difference they could make. And I think it's about making difference, isn't it? So I think that was the way I'd go along. I wouldn't say I was an evangelical, I must be a doctor. I just thought these are topics I enjoy. I suppose I'm comfy talking to people. So I think with a doctor, you've got to have a degree of communication skills, and that's important.
I think that's a very underlooked skill of being a doctor, because you've got someone elderly, young, man, woman, different, and you've got to allow someone to go, I'm ill, or I'm vulnerable, or I don't show these parts to everybody. Yeah. And it's a true skill, isn't it, really?
Yeah, and when I went to medical school, we did some training in it. Now medical students do a lot more than we ever did. So I think that's a good thing, because you're right. A doctor's involved in the peaks of someone's lives and also the depths of their lives, aren't you? You're there when great things are happening. You're there when the worst things are happening. So you've got to have, communication is probably key. And I think I've got an uncle, bless him, who's a professor of physics. And he says, I don't understand why we take all you intelligent people and let you be doctors when you be better engineers and physicists. He said, because your brains are good. And I kind of think he's got a point in that, because there is, you need a degree of intelligence, but also you need that compassion and, talk to people and get it right wherever you can, really.
I think like in Lee's scenario, you go about having a bad back and then you come out realising you're having a breakdown, and it's having that person who can see the mask coming down, going, you've just come in through your bad back, have you? You sure tell me more about it. How have you? And then next thing you know, floods of tears, because most of us, we make an appointment for a doctor. No. I'm feeling better now. I'm more. So how many times we have to make an appointment, to cancel an appointment, to actually get there, and then you go, I'm going to tell them this time. I'm going to tell them I'm suicidal. I'm going to tell them I'm suffering. How are you? Oh, yeah, my back's gone again. We bottle it at the last moment.
Yeah, particularly as blokes.
We do, don't we? And sometimes you make an appointment and you want to go, and you're thinking, is that element of sheer vulnerability and realising I'm not bulletproof. And that Del boy I don't want to go to the doctor because every time I go, it tells me I'm sick. And like sometimes, if I go about my testicles, if I go about my urine, how about if they tell me I've got the big C? And you know what I mean? It's like, would I rather die in ignorance? But no, if we get it early enough.
You'd be a good GP if you diagnosed cancer just by that, though, Kev.
No, but
I hope there's some other tests involved.
But on anything, you need that first step to get to the next step. Yeah. And I think it's the first step's the scariest one, isn't it?
I think, as with a lot of things, I think you're right. I mean, I think you're right. I mean, we talk about people having a thing called the hidden agenda. They come. And in the end, the problem's put on the table. I think, that's not an unusual situation. I think it's more common in blokes. I think that ladies tend to have better social networks than us. I mean, you'll find ladies will share problems and discuss problems much more openly with their friendship group, whereas us blokes don't. And I think it probably is, we want to be seen to be strong, and maybe it's a weakness that sometimes will bite you on the bum.
I think most of the time it does, doesn't it? Well, we've both been in a situation where we've been trying to be strong, and ultimately it does turn it to a weakness because you're not getting help, and and that can be whether it's a mental health condition or a physical health
Yeah.
condition. You know, the longer you leave these things, the more they fester,
Yeah.
and the worse they get.
But I remember having a testicle infection, and my testicle keeps swelling. It's hurt me too, right? And then I went to the doctors and had some tablets, and it didn't work. And it's swell. And I remember going, lying on the settee, thinking I was going to die. I just went to, I was living at my bungalow at the top of my parents' gardens. I went there to die, basically. One rushed me to hospital, and the blood had gone from my test, the infection got from my testicle into my blood, and I thought I was going to die. Because you leave it too long, it'll be all right.
Mm-hmm.
I've been to the doctors, give me these tablets, and I'll be all right, or I'll be. Instead of thinking, no, I'm not all right, go back to see him.
Yeah.
Go back and think it'll sort itself out. And how many people must have lost their lives, limbs, bits and bobs? It'll be all right.
Mm.
It'll sort itself out. And sometimes it doesn't, and you need that professional, don't you?
I think it's knowing when to ask that question, isn't it? Because I think the reality is a lot of things get better with time. And that's a really difficult. I often say to patients, it's really, really difficult to do nothing. They come in with a group of symptoms, you examine them, you look at them, you go, I just don't think it's anything serious here. You know, we got to sit and watch and wait. And I think that's a very difficult time for a doctor. It's a difficult time for the patient as well.
Well, you don't want to hear that. If you're going as a patient, you want this person to give you the magic pill that kills you, don't you? And ultimately, sometimes there's not that pill. It is just about rest and recouping. Yeah,
and time. You know, I often say to patients, you know, I can't write time on a prescription, but this will get better. You know, there are lots of illnesses where you say, actually, this is going to pass, but I can tell you it's nothing serious. And I must say it many times a week. I often say to patients, you know, I can tell you what it isn't, and that's the important thing. But I can't tell you what it is. I can tell you it's not going to be serious.
Well, we had Vicky on, who's a dietitian, and she was saying about like how some conditions went away in furlough, like your IBS, because all my tummy's better. And it's now I've taken work out of the situation. I've taken my work colleagues out of the situation. I've taken the commute out of the situation. I'm actually feeling a lot better. The modern day stresses of 24-hour, you know, so can get, like, I always talk about this. When you have the house phone, people wouldn't phone you after 8 o'clock because it's your family time. But someone will send you an email at 2:30 in the morning, or a WhatsApp or a Facebook, and you're thinking, no time is sacred. You're available at any time of the day. And work, you know, it used to be a 5-man job. We've got rid of 2 people, and it's a 3-man job, 3 people in the office, but you're still doing a 5-person job. And they put so much stress on people. And I don't want to leave in case I don't get another job. I'm struggling to, and these emotional stress and these financial stresses, these are drowning some people, aren't they?
I think you know, we talk about digital holidays, don't we? You just turn your phone off. And I must confess, when I go on annual leave now, I tend to not answer any work emails. I just said I'm not going to do them, because I have been in a situation where you flick your phone and you start looking, and it's quite nice to do that. And a couple of years ago on holiday with the kids, well, I say kids, they're in their mid-20s now, I nicked all their phones and put them in a drawer and wouldn't let them have them for a day. And to begin with, everyone was like agitated, where's my phone? And by the end of the day, they go, this is quite nice. We have to talk to each other, and we have to go to the bar and buy a beer or whatever we're doing, you know, and everything becomes more interesting because you're not glued to your phone. And you know, mental health issues often, as you know, they often say, tone down your social media, turn your phone off at night because it isn't pinging or lighting up.
That's exactly what I do. I'll come off social media because I know you can get in that rabbit hole of just standing there, and it's just wasted time. It's absolutely wasted time. There is reasons I still have to use it for my business, so I'll set up different accounts that is just for the purpose of doing that. So I know if I go on there, it's to post something about my business, not to sit there scrolling through and just it's not productive. And I don't think not only is it not productive, it's not resting either.
No.
So it's not like you're chilled out doing it. So it's as much as I say, I've just come off it on that and just use it for the business side of things, or for the Black Country Blokes. And I feel better for doing that.
Yeah.
Feel better for putting it down and going right. Because of the situation with my daughter as well, it's very rare I turn my phone off. The only time I really do it, we have a caravan in Wales where we all go and we're all together. But apart from that, really, I don't turn it off, because if I'm not with them, then there could be a call coming that's emergency that I miss because I turn it off, and that scares me more than actually having it, turning it off, or if they're out and about and they can't get hold of me and all that. So, but when we are down the caravan and we're all together and I don't have to worry about phone, but it does take 2 hours to think of something else to do, because you're that used to having a phone in your hand. You're that used to being it. But do you think you're going to see a bigger rise in people coming to you about mental health problems because of the technology they're dealing with?
I think undoubtedly. I mean, I think it's the thing with technology as it stands now is that you can, things are instant, aren't they? The feedback is instant, the criticism is instant. So I think they undoubtedly, and we've seen a lot in the press, certainly, you know, the social media does contribute to mental illness. I think no problem at all. It's very clear cut, you know, and I think also because you can fire away immediately, I think people are probably more unkind, you know.
Yeah.
You know, and it's an interesting, I saw in the press, poor Mac Hancock has got himself onto I'm a Celebrity. And of course, everyone's voting to make him do things. And another journalist in one of the papers was saying, well, you know, this isn't just fun, you know, making him do things which are unpleasant. It's actually beyond that. It's fun maybe once, but if he's just going to be victimized all the way through his program, well, what's the point? And so I think it doesn't help.
No, I mean, it's always a double-edged sword because, like I said earlier, I managed to go online and just self-refer myself to fantastic. So it's always the two sides of it, isn't there? But you've just got to make sure that one doesn't start out balancing the other, or if it does, at least it's the good side. You know, it needs to. But you're right; people can just comment and just say what they want, and there's no consequences to it. Bar getting banned. Well, if you, and that's in an extreme situation, you get banned, and if that does happen, you can set a new account up within seconds on a different email, and you're off again. I think a lot of kids in school is often the problem area. You know, I think in the past, you know, 30 years ago, bullying would be visible, or be name calling or whatever, and the teacher could see it, and peer groups could see it. Whereas now it's very, very personal, isn't it? And you don't know. And I think that never ending, isn't it? As well, like,
and there's
no stop at the end of school. You can't go to your home.
Definitely a problem.
Have you seen a massive jump in that, like in the 30 years? You know, I mean, like I can't remember being anxious about school. I can't, you know, you wear tinted glasses and all that, but I bet you have so many more, even like primary school children coming and saying, I'm having panic attacks and anxiety attacks. And
I think there's two things, aren't there? We've got the social media and society we live in. I think also there's a degree, I mean, one of the things that I think is challenging is when parents come in saying the child's got a problem. And I think that's really difficult for a child to hear your parents saying you've got a problem. I agree with you. I always look at school. I would say the kids come to me, you know, school days were the best days, you know. And I think so. I think there's a degree where people will say, you know, my child's depressed, like, you know, and actually they're not depressed. They may be unhappy.
A bit down, a bit sad. The hamster's died.
They're not depressed. And you know, I had you know, a child recently whose mum, you know, he's 7 years old. Mum saying he's happy one day and a bit sad the next. Is he bipolar? And I said, no, I don't really think he is. I think he's a 6 or 7 year old who's having the ups and downs that 6 and 7 year olds have. And actually, and I think not just with kids and mental health, but I think a lot of things in healthcare are, we've almost lost the perspective where normal is anymore. Same as we have with the social media, but, you know, where's normal now? And actually, and so I think that gets quite difficult for people. And they want a fix or a pill to fix all ills, and there often isn't. So back to how do we give people time to get better and have the confidence to get better? Because that then breeds resilience for your future life, doesn't it?
It's the double-edged sword again, isn't it? With mental health, obviously we're raising more awareness, hence the podcast, and loads of other people raising that awareness. But now there's people who are getting confused between being depressed and being sad, so you're getting that other side of it where, and I suppose you can talk yourself into a depression as well, can't you?
And it's
you
also very contagious.
Yeah,
you know, if you're around it all the time, you see someone's nerves. But I think it's when we overuse words. Just like I was having recently terrible migraines, and they did. It felt like someone was gouging out my eye, and I had pains. And then someone has a headache, and you have like, oh, I've got a migraine, or I'm being blind. They go, oh, I'm blind without my glasses. Go, no, you're just not wearing your glasses, or I'm depressed. You're sad. You're down in the dumps. I'm anxious. You've got exams, or I always said nerves have pushed me through life. You know, the deep breath, step forward. Anxiety, when I have an anxiety, it's crippling. I feel like I'm having a stroke. And it's knowing the difference between I'm nervous to I'm in a state of, I think I'm going to have a heart attack. And it's not, more we overuse words, yes, you take away the words, don't you? Do you agree with that? And I think,
I think
education of words.
Yeah, I think you're right. I mean, if you desensitize yourself to that, don't you? I mean, and that's what happens if you use a thing repeatedly, you become less sensitive to that stimulus. And that I think you're right from that perspective. You know, anxiety is normal. You know, I might get an ill patient, I might be a bit anxious about it. When that's a problem is when you get panic attacks, etc. And it's really interesting. You look at people, you know, with people doing a task for which they're reasonably well trained, a little bit of anxiety improves your performance. When you get to the level of panic, it destroys your performance. And it's that subtle difference, isn't it? And you're right, because panic attacks are they are overwhelming because they control everything that's going to happen. And like I said, I think that's where you come back to your mental health counselling, etc. Because medication actually won't cure panic attacks. It'll help you manage the symptoms at the time. The long-term solution, what I say is one of your tools in your toolbox for life is, how can I manage panic attack? How can I? Because actually, once you can put that panic back in the box, the feeling you get from that is great. But it takes time to learn how to do that. And I often say to people, so medication won't cure your panic attacks. That's where your counselling, therapy, CBT, whatever else comes in. And then once you've got that skill, like any other skill, keep practicing it, like your boxing. And I think that's the thing a lot of people forget, whether it's people with a bad back, that they go and see the physio, they have some physio, they have some exercises, and then a year later come back with their bad back, and you say, "Have you been doing the exercise?" "Oh no, I'll stop doing them."
Once you stop hurting.
Yeah, and I think I really think going back to your talking therapies, brilliant, but keep practicing it. And the same with physical things. If you've got a skill, you practice it. Whether you're Tiger Woods or you're Andy Murray, you practice your skills. And the same applies for mental health and physical health.
And sometimes you've got to practice the things that you're not good at to get better at them. If you're naturally good at it, then you haven't got to practice that as much, unless you want to excel at it.
Yeah.
But it's the things that we struggle with that we have to work on.
That's right. And you tend to gravitate to what you're good at. Because if you're great at art, you'll tend to keep doing that because you're great at it. And you're right, you need to look at where there is a weakness that I can use to build on to actually, complete my toolbox.
And what I've learned with NLP and different things is, when I start becoming aware of negative thoughts and sad thoughts and depressive thoughts, and so it's like I said, like about my earworm, I start hearing, because I'm very auditory, I love music, and I start thinking, like Hurt by Johnny Cash, or I hear songs and I start thinking, all right then, stop, change the record, think of something positive now, do something positive, but they're the tools you learn, aren't they? If you're aware, thinking, well, I'm not good at this, or why does this keep happening? My friend said to me, in life, you've got two choices: make changes or make excuses. I can either make the excuses everyone else, or make changes of, how can I get over this? How can I get better at it? How can I stop this from happening again? And I think once we can do that, I think we've got to break the stigma of getting counselling or NLP or whatever it is, because you'll pay for a personal trainer, you'll pay for a dietitian, you'll pay for all these wonderful things. But can't pay someone to try and help you to figure out your head.
Yeah.
And I think if we could start doing that at a primary school level and getting people to be, well, why are you crying? Why are you hitting? Why are you wetting yourself? Why are you figure it out then hopefully we'll grow up into being happier, better people and not being frightened to talking about our feelings.
I think you're right. I think talking about your feelings is important, isn't it? I think the challenge is it's always that perspective. One of the things I always wince at is when there's some sort of tragedy, and whatever it might be in a children's school, and it can take all forms. When they say all the children having counselling, and actually, if you look at it, if you have a trauma, particularly adults, but particularly with kids, if you have a trauma, if you keep reenacting that trauma, or keep reminding them of it, actually imprint it. And so actually what the best way to manage it, probably in most cases, say, let's see how things go, let's observe and help those who need the help, because kids are always amazed how resilient kids are. We think how little life they've had, how amazed that they're amazing, amazing resilient, and actually pick up the ones who need the help, but don't, you don't need to go for everybody. And there's a lot of research, psychological research, say that if you replay that initial trauma, you actually risk making it prolonged for more of them. And there will be some kids who have a real problem, and those where you want to focus your resource. But that's very difficult. So when they say something happened, and then the headmaster or headmistress says, we've got some counselors coming to school, I always go, oh, well, let the kids have a bit of time to process it, because we all process grief and difficulty in different ways. And kids, like I said, I think, we always think kids are really vulnerable, and they are in some ways, but in other ways they're much stronger than we are. Kids on the whole, they don't have heart attacks, they don't have strokes, they don't have the physical things that we get as we get older. So as little people, they're really tough. And I think
they don't have the baggage either, do they? No. So look, we carry a lot of that around. Yeah. So when something else happens, it could just be that one thing that pushes you over the edge. Yeah. Whereas hopefully, majority of children are not at that point already, and that won't push them over the edge. So it's
So with kids, I think sometimes going back to the conversation 10 minutes ago, sometimes we over imprint on the children some of our own feelings. It may be loss of a loved one for one of us. If that happened near to us in the workplace, we start thinking about our grandmother or our grandfather or our mother or a friend. As you say, a child hasn't had that experience. Naturally, my experience is often that kids are really, really practical about some of these really difficult things.
And I think with the beauty of them is everyone's in it, as you say they are, and they're beautiful, aren't they? And as I said, the courage of them, how they deal with it, is amazing. And I think we've got to be there to support them. And I bet it's for yourself. I mean, I was a poorly child. I had meningitis to stop me. You've got your poorly daughter, and I bet when you're seeing the children coming in there, it is remarkable how these brave little souls can handle even the worst news.
Yeah.
And it's almost sometimes they have to comfort the parents.
I think you're right. I think that often runs with a lot of illness. I would say to families and patients, the person in the eye of the storm, actually, they've got to deal with it, and they deal with it. And whether they're a child, an adult, whatever, they're often, they're inspiring. And actually, it's us around them who are sitting there saying, what do I do? Where do I go with this? And so often, you do find that the person in the eye of the storm is really strong. It's the ripples around them. Where
I can relate that with my daughter, because my daughter's not aware of it, to be quite honest. But I certainly am. My wife certainly is. And I think you do. You do. And I think the thing is with me, I can't help her. I can help, if she's ill and she's down. I'm not a doctor. I don't do any of that. I can support her, but I can't. There's not a magic pill I can give her that solves the problem. And I think that's the thing with your loved ones. You want to solve their pains, don't you? You want to stop those from happening, and maybe that's why it kind of affects you in that way. Whereas if you're going through it, you just.
You'd rather go after Green Mall, suck it out, don't you?
Yeah, that's it. Yeah.
Deep breath and I'll have it now, and you're more right.
Yeah, that's it.
It just doesn't work like that, does it?
No, unfortunately not.
No. But no, it's a point well made.
I bet as a doctor, I bet it's heartbreaking sometimes when you're seeing it, and it's like when you give the news or you refer, and then just seeing that helpless parent or that helpless loved one, and thinking, your life's probably never going to be the same now. And I bet have you had cases where your day job was really affected?
I'm hopeless. If sometimes patients say, "Will you come to my funeral?" And I'm just hopeless. As such as everyone else, and I that's just me.
Yeah, I am on the road to
and that's just me. Yeah, it does. Of course, it upsets you. And it's how because you've got to work with the patient, their families, to get the best outcome, whatever that may be for them. It's hard work. But like it's also a privilege. And that's what you train to do. Like I said, at the end of the day, working with people like in extremis, because actually, like I said, the person in the eye of the storm often is rarely a problem. It's the people around. But I think people are amazingly brave, amazingly resourceful. As you said about your daughter, remarkably resourceful, and it's from her perspective, this is how she'll carry on. And I think the same with people we know with life-limiting illness. I think most people are remarkably brave. It's the people around them.
We were on about epilepsy last week, funny enough, wasn't we?
Yeah.
We were saying about your daughter, and there's so many different forms of epilepsy, isn't there?
Yeah.
And so many different seizures.
Yeah.
And you're saying about your daughter saying about she stares into space unless you're aware of it.
Seizures, there's quite a few. I mean, was talking about SUDA. I don't think that was talking about sleep and my lack of sleep because of worries like SUDA, because that's one thing that does happen far too often, and there's no explanation for it. And obviously that disturbs my sleep as well as other things. But yeah, that's what it was about, wasn't it, really? And how horrible that side of it is.
A bit more of a professional fix. It's very common, isn't it, epilepsy in this country? And very underfunded.
It's a lot more common than I realised until I read some facts a couple of days ago. And it's there were three diseases: Parkinson's, motor neurons. Can't remember the last one, but basically it's double the amount of people suffer with epilepsy than those three put together. And that really surprised me, because I thought Parkinson's, because rightly so, there's a big movement regarding Parkinson's, and there's massive funding, something like £225 per person with Parkinson's, whereas epilepsy, it was £26 funding going in towards epilepsy. But it just amazed me that there's that many people who suffer from epilepsy, and you don't, because it's unseen the majority of the signs. Like,
you're right. If it's well treated, you don't see it, do you?
No, that's it.
Someone who's got epilepsy who's well treated, you're not going to see their epilepsy.
Yeah. Well, I'm not sure it's well treated or under, because my daughter's epilepsy, it's medication resistant. So it's getting the right balance of medication, isn't it, for some, and it does do it. And some children, they just grow out of epilepsy. So it is that fact that you don't.
Yeah, you see. I mean, I say kids get. I'm sure you've heard of febrile convulsions. So they're really common. So kids who get hot, often under the age of 2, but maybe up to 5, they get a fever, and that puts them at increased risk of having a fit. And they grow out of those virtually exclusively. Although you've had febrile convulsions, you're at a high risk of having epilepsy later. And this is when you see a child who's got a real temperature. They may be what we call jittery. They're a little bit shaky, a little bit anxious, but they're not having a fit. So febrile convulsions you tend to grow out of. And then you're right, epilepsy often comes on through childhood, and some people then grow out of it, and it depends why they've got it. So for example, and this doesn't apply to children often, but if you've got somebody with a brain abnormality, it could be after a head injury, it could be all sorts of traumas leave scarring on the brain that can act as a focus for epilepsy. So obviously you gather trauma through your life, so therefore that gets more. So epilepsy tends to get more common for those reasons. And then some people will grow out of them, and then you get this really difficult thing of, do we stop the medication or not? Because of course, you stop the medication, they have a fit, they can't then drive, they can't. And so they go, well, their job could be around driving. They go, well, I don't want to stop that. And so there is it's a really difficult area. And like I said, and most people with epilepsy are well treated. The medication does have side effects, so you've got to be certainly. They can slow you up a little bit to begin with, so you want to keep kids particularly on as little as keeps them controlled without giving them too much medication. And then there's an issue with pregnancy on anti-epileptic medication. There's been a lot in the press that with abnormalities. If you get pregnant on anti-epileptic medication, they've got really difficult decisions around ladies on anti-epileptic treatment in pregnancy. So and it is probably, as you're right, it's a Cinderella area. It's probably because quite a lot of people are fairly well controlled. But you're right, you do get treatment-resistant epilepsy, and then you get into the clever deep brain stimulators and other bits and pieces for people who are very resistant. And rarely surgery. Sometimes you can do surgery for epilepsy. Yeah.
Sure do. Sometimes that's how to rescue medication.
She at least once a week rescue meds. And she's also got a VNS fitted. She's on 3 anti-epileptic drugs. One being a CBD oil, which is I think the only 2 people in the UK who prescribed it, and she's one of them.
Oh, right. How's that gone?
Absolutely fantastic to begin with. Really, she was 100 seizures a day, dropped to under 20. Different various seizures, but as time's gone on, she's getting resistant to that as well. Right. She's also on another drug which is being trialled called, or in the last stage of trial, fenfluramine, which is an old weight loss drug. Yes. That has been repurposed for epilepsy, for her type of epilepsy, should I say. Dravet syndrome. So yeah, it's there's a lot going on, and she's unfortunately still resistant to it. But I've always said she's a happy little girl, and really, what more could she want? And she won't have the worries that we have in life. She's 8 years old and has a mental average 18-month-year-old, so she won't have the stresses and the worries as we ever. And basically, as long as she's fed, she's really happy.
Yeah,
she has a fulfilled life.
Yeah.
So that's all we can hope for, really, as parents.
Which we want for everybody, isn't it?
Yeah, that's it.
You want whatever potential you've got to achieve it, and enjoy what you're doing.
And you change your talking potential. You change. So with my eldest two kids, their potential. It's a different kind of potential, isn't it? Like my daughter's achievements are absolutely amazing. When she started standing up, and she at one point she was fully tube fed on oxygen full time, and she's got never ate anything, and within the space of 2 to 3 years now, she's off oxygen unless she has a really severe seizure. She eats just about everything, and you just crawling around, and that's such a massive achievement, but not necessarily what other people would see as an achievement, because most people take things like that for granted. Take things like granted, like I can stand up and walk. You don't, until you lose that ability, you take it for granted.
Yeah, absolutely.
That's what, and that's important. Again, back to the gratitude list, because we used to do a support group in there.
Yeah,
and they go, "What are you grateful for? What am I going to be grateful for? Well, can you talk? Can you walk? When you get to the toilet, can you flush it away? Well, yeah. Well, imagine if one of those simple things were taken away.
Yeah,
it's not until you got a blocked toilet or your hot water, and you're thinking, "Oh God, it's them simple things that make all the difference, aren't they?"
Yeah, they are.
I mean, with men's health, because it's Movember now, isn't it?
Hence, I've got my moustache on.
And it's a lovely moustache it is.
Never just lazy and can't be bothered to
Is that the irritating stage? Because they always laugh at me. They say, why don't you grow a big? I said, because there are rules. And the rules around November are very simple. You have to start the month without anything. You can't grow a goatee. You can't grow a beard. I think that's about it, really. So you actually can't get a fantastic handlebar moustache, because I don't never met anyone who can grow that in a month. So I have to put it, and then like it grows.
Sounds like a challenge for you. That does, Kev. I reckon he could.
And then you get this irritating phase where it is now, and then you start to develop behavioural problems.
Yeah. What do you think of Movember? Do you think it's a good idea? Do you think it's a gimmick? Do you think?
I think it's great. I think it's like I said, blokes aren't great at doing things for blokes. November actually is great, because it's men and women on. If you be on the website, it's for everybody. It's not just for us blokes. I think it starts off as a focus on prostate cancer. But if you look at that, it's very big on men's mental health and testicular cancer as well. And not just those things, it supports all sorts of other initiatives. So I think it's a good thing. I think it's worldwide. I think it's just fun. They probably spot a lot of the rugby players the weekend. If you watch rugby, the England rugby players are all, of course, they're only about 23 years old, so they're growing their moustaches. And I just think it's a good thing for people to get together and have a good laugh about it and raise some money for a good cause. I think it's typical of blokes, actually. Ladies do things like the moonwalk, where they go out and walk all night and stuff like that. So they're doing more, making an effort to raise money for women's health. What are us blokes doing? We're shaving less. We're just doing less to raise more, which I think is good.
Because I mean, like, for blokes, it's prostate cancer, testicular cancer, and rectum cancer. And I think we need. What are the big signs? And men can also get breast cancer, can't we?
You can. I mean, it's rare, remember. I mean, yes, you can. I mean, probably less than 1% of breast cancer is in men. But
what's that low?
Yeah, but when you bear in mind how common breast cancer is in ladies, they say 1 to 6 to 1 in 8 women get breast cancer in their lifetime. So actually, it's not unheard of. I've seen it once. I've probably seen it once or twice in men in my time. So it does happen, but it's very, very unusual. The prostate, classically, old men will come and see their GP saying, I'm up 3 times in the night, and the symptoms tend to run into one of two groups, really. Some people get problems with sort of blockage, so stopping and starting becomes a problem. So they may say, I go to the toilet, I stand there and I just can't quite pee, and then I start peeing and I can't quite stop, or I stop and then I dribble on a little bit. So you get what I call obstructive symptoms. Other people get irritability symptoms. They'll say, I just have to go. And that's because the prostate gland sits at the base of your bladder, and as it grows as we get older, it starts to irritate your bladder. Your water pipe moves, it grows through the middle of your prostate gland. So that's why you get the obstructive symptoms, and then the irritation of the bladder is why you get the irritability symptoms. And some blokes get a bit of both. So I think, and those symptoms are quite common as we get older. And I think, if you're getting those symptoms, you ought to go and see a GP.
Yes.
Rarely you can certainly get blood in your pee because of prostate cancer. And again, you get blood in your semen if you have prostate cancer. So if you get those symptoms, I think, as a rule of thumb, blood out of any way you can't explain, whether it's vomiting blood, whether it's coughing up blood, whether it's blood in your motions, blood in your pee, you should be seeking some advice on that.
And then, when we were saying earlier about it'll sort itself out. If you start seeing those symptoms, go and check.
Well, my dad got diagnosed with it, I think it was started this year.
Yeah.
So I've read up about it after that, obviously trying to educate myself a bit more, and it surprised me that how many men live with it and it has absolutely no effect on their life. And it's a lot more men live with it than you realise, I think, is one thing I found out. And it's not a death sentence, because most people hear cancer and it is bad news, but it doesn't have to be a death sentence, does it?
If it's treated.
And a lot of it's just monitored as well, isn't there? There's not, they don't actually treat it.
With
just
prostate
monitored.
cancer, I think it's changed. I think again, when I was first adopted, you asked what's changed. If you had a raised PSA, so that's a hormone produced by the prostate gland, if that's raised 20, 30 years ago, you often ended up having a biopsy, which is not a very pleasant thing to have done. And I think what's happened is that now we've got much better MRI scans. So what will actually happen now is, if you've got a raised PSA and the gland feels normal, or feels abnormal, if it's abnormal, you probably get straight onto a biopsy. If the gland feels normal, you now tend to get high intensities or MRI scans, have a good look at your prostate. If the prostate looks normal, you may want to say, well, leave it alone. We'll just watch this for a bit. And you're right. So a majority of men with prostate cancer die of something else.
Why do they have hormone injections? What's that about?
Because it's it's similar to breast cancer. In that breast cancer relies on female hormones to provide sort of, not nutrition, but to stimulate the cells to keep reproducing. So prostate cancer relies on the male hormone testosterone. So what happens is, you're right, a lot of men with prostate cancer, they may have radiotherapy, they may have their prostate gland removed, or a majority of men will often end up having these hormone blocking tablets or injections, which basically remove the testosterone. So that, for want of a better word, that reduces the drive for the cancer cells to grow and spread.
And is the side effects of that, would you say, just a bit more?
In sympathy with our ladies, very similar to menopause, because what you actually do is you drive down. When a lady hits the menopause, her hormones are obviously fall, because of what happens with menopause. So we kind of do the same to blokes. So you cause their testosterone levels to fall and reduce, and they will often complain of hot flushes, and they may get tender breasts with it. They do get quite a few symptoms with it.
So it's like prostate. So with testicular cancer, because they're always saying, like, check yourself, but it's something that we don't do enough, is it? Once again, it's, when I have my testicular infection, you get embarrassed about your bits, and it's, is that normal? My imagination playing up, and but it's stuff that a bit of embarrassment could save your life, couldn't it? And it's never been embarrassed, because, quite frankly, in your 30 odd years, you've seen near damn everything, haven't you? Damn everyone.
I think it's the same for ladies, the same for men. The people who know your testicles best are you. And for ladies, people who know their breasts best are often them. So I think there is self-examination in both those groups is really important. And for a chap, if we can be blunt about it, a warm bath is a good place to, feel your testicles and get to know what your testicles feel like, because we're all different. And like I said, if you have pain or a lump you're not sure about, then pop in and see your GP, and they'll be too happy to help you out. I mean, unlike the prostate glands, very, very simple. If there's a query about a lump on a testicle, we actually just do a scan, which is just an ultrasound scan. So it's not invasive, it's not unpleasant, and gives you an answer, very, very quickly. And 95% of the time, most things aren't what you think it is. Most things are benign, But the important thing is get information.
And they're the two big symptoms of testicle cancer, though: lumps and pain.
I think
Usually,
yeah. I think lumps, again, blood in the semen or blood in your pee can be. But yeah, I think a lump is the major thing that you should look out for. And the problem is that testicles, you do tend to get lumps on them anyway. So you've got the body of the testicle, the pipe work, so the blood vessels that supply the testicle, you can often get little lumps of gristle and things in there, and that's why you need to examine yourself and get to know what you actually feel like. And so, like the majority of lumps that I see in testicles actually are cysts in that pipe work, but you only know that after the event. So if you feel you got a lump, you should go and see a GP and get it checked out.
And are they the two biggest cancers in men, testicle and prostate, or is it rectal? Is that
No, I'd say that in young men, so probably under 25, testicle is probably most common, and old men, prostate is most common. I mean, other common cancers are lung cancer and colon cancer. They're probably the two commonest ones. There's a lot of skin cancer, but again, skin cancer tends to be, a majority of skin cancer tends to be not really life-threatening. Melanoma is a real problem, but a lot of skin cancer tends to be sort of, on the whole, fairly minor. But yeah, I mean, you're like I said, prostate end of life, and testicles in your sort of teenage to young adulthood. It's common as cancer.
And then the other biggest killer of men is suicide, isn't it?
Yeah.
And out of all of them, suicide is probably the most easy to prevent. You know, it's a pandemic we can beat, isn't it?
I think suicide is a really, really difficult one, because I think what tends to happen with suicide is that people are in a position and they don't, you know, we've talked earlier about seeking help, talking, sharing your problems. I just think men aren't very good at it. So I think the first thing is we're not very good at discussing their feelings and those problems we're having. I think the second thing that tends to happen with men is when they do something, it tends to be quite, they choose violent ways of ending their lives. So they do it, and therefore they end up not surviving the suicide attempt. And I think it's tragic.
Yeah.
I mean, there's lots of evidence that, you know, most people who commit suicide, male or female, have some contact with healthcare in the previous month. If they're under secondary care services, under specialist services, you know, 70% of them have contacts in the previous week. So you're right, there is a degree of preventability about it. I think, but firstly, from the doctor's point of view, it's important you assess the patients. I think from us as blokes' point of view, it's about, I think sometimes those acts of kindness, just saying something, are you all right?
Yeah.
You know, and actually, the chap might go, well, no, I'm not actually. You know, and it's just that asking that question. And so I think, you know, almost these acts of kindness where you just say, someone looks a bit down at work, or you might just be sent out on train, they just look a bit preoccupied. You say, are you all right? How's today been? Nice weather, isn't it? Those sort of social interactions are reduced compared to, you know, when we were younger, or when I was younger. So I think, you know, there's the professional side of it, there's the individual side of it, and there's a society thing. I think just being nice to people, you know, just saying, how's that for you? How are things going today?
We count ourselves very lucky that we've got after starting up the podcast, we've got each other who we can talk to now, don't we? And that's made a massive difference with both of us, hasn't it? That there's always someone there who you know is not going to judge, knows not you know. And I think everyone find someone who you can talk to about these things, whether that be a professional, whether we had Papyrus on the radio last week, and if you're not comfortable talking to a friend or your partner or a family member, then try and find that professional help. People who are not there to judge you, they're literally there to pick up your phone and listen. It's so underrated, isn't it? People just listening to other people and noticing. And
I think one of the things that I always remember from my medical training is they said, you know, if you get somebody with a problem, it doesn't have to be suicide, it could be alcohol, anything. If you lecture and preach and say this is a solution, that actually turns them off. And actually it's the regular little contacts that make a big difference. So there was a big study, it actually was about giving up smoking, and they showed you could sit patients down and give them all the facts about smoking, which of course all smokers know. So you're not telling them stuff they don't know. Or you could say to them, you're all right, you thought about your fags recently, how's it going, whatever. And they found that the little quiet, gentle intervention was just as effective as the, you know, this is what smoking does to you. And I think the same applies to suicide. You know, it's that little, are you all right? Or how are you today? Or you don't seem your normal self. Or even in someone you don't know, you could be, you could be sat in the pub having a pint and you go to the bar and someone, how are you today? How's it going? And I was doing a course last week on exactly on suicide. And there's a very good story about a young lady who was actually working behind a till in somewhere like Wilko's, and somebody went in and bought a load of tablets, and the patient fed back. The lady behind the till said, "Are you sure you need all those? You're all right." And he said it just turned him round to actually go and make a difference and ask for some help. And so I think don't those little acts of kindness, don't underestimate them.
And
share them a bit. Share them a bit.
And I think once again, like with the phones there, and
yeah,
if you ain't got your phone, you tend to clock someone, don't you? And
yeah.
When we go around out to the girls, my wife and my daughter go to the toilet, and because I'm not looking at my phone, I start looking around and I listen to conversations and I'm check what she's wearing or bloody hell, what they on about, dirty buggers, and and but you're there, and then you're a boss, you're okay. You look at it, but otherwise you're looking at your phone or don't make eye contact. He looks down, but for God's sake, don't talk to me.
Yeah.
But when you have got nothing else to do, being kind becomes an option.
Yeah. I just can't, I like your watch. Where do you get that from? Well, that's a nice blazer or something. And honestly, it works. It's almost, they say random acts of kindness. It's barely even kindness. Random acts of just being civil to people who just contacting people around you and getting that network thing. And they may just say, well, actually, no, I've had a bad day, or I've lost my job, or I'm really struggling.
Might just appreciate being noticed.
Yeah. They might go home thinking, oh, you like my haircut. It's great. So I think it's important.
Well, Dr. Steve, thank you ever so much for coming on today.
That's been an absolute pleasure.
We'll get you back on, but we always like to end it with, have you any quotes or sayings that have helped you get through life?
Quotes or sayings? Do you want amusing ones or
any ones you want? Anything that pops in your mind?
There's one that's serious. The most important things in life aren't things. I think that's really important. So it's not about what you've got. It's about all the other stuff.
Yeah.
One I always like is another one I like, which is serious. Serious, it's good. Is all we will leave behind is our DNA and memories. So make sure those are good ones. And my favourite French saying is "Pleur, pleur, tu pisseras moi." When someone's crying over something they shouldn't really cry. We'd say cry over spilt milk. The French say cry, cry, you'll pee less. So 2 serious and 1 light-hearted.
That's the first French quote we've had on.
I think it's a great one. It's the sort of thing you'd say to a child who's crying over they've dropped their ice cream or something. It's I just think it's the French are good at many things, and that's one of them. But I've enjoyed it. It's been great being here.
No, thank you very much for coming on.
So, guys, until we see each other next time, I want you all to take care of yourselves and each other. Ta-ra a bit.
Listen.
And that's a wrap for another show. But if there are any comments or messages that you would like us to read out for our next podcast, please be in touch. There are also lots of different organisations at the bottom of this page, and hopefully they can help you or someone you care about. Please share this to spread the word. Until we talk next time, ta-ra a bit.